You have a few love handles you want to get rid of? Well, liposuction may be the answer for you if you've got the right skin. And so we're going to go right back to the phones and take your call, Linda. Monica, sorry.
Oh, hi.
Hi, Monica.
Hi, I'm 20 years old, and I wanted to know, would it be too early for me to be considering liposuction? And if I was to get pregnant, will I gain the weight back in other parts of my body, or will the weight double up or anything like that?
Monica, thank you for asking that question because it's a very good question. Answer that one because, you know, she's a young woman. She's looking at, well, first, let me go back to Monica. Sorry about that, camera people and producers. But Monica, how tall are you and how much do you weigh?
Okay.
Let's get some basic little facts here. 5'8".
And I weigh 194 now, but I went down to 170, and then within 2 months now I gained about 15, 20 pounds.
So you went back up a little.
Yeah.
So you're back probably in the same territory. She's 5'8", about 170. So, okay, she's 20, possibly going to have a child.
Right.
How do you advise this particular patient?
Well, the pregnancy has really no bearing on whether or not you're a candidate for suction. But the interesting point of the question really is what happens if you gain weight later? Again, what we're trying to do is contour areas where there are localized fat deposits. And the reason they're localized is because of two reasons. One is there are excess number of fat cells in that area, and each of those cells is filled with fat. When we do the liposuction, we're removing fat cells. And once those fat cells are removed, they are permanently gone, so that if you gain weight, for example, and your patient who has a saddlebag and we do liposuction to get rid of the saddlebag, you can gain weight, and you can gain 20, 30, 40, 50 pounds, but you're not going to get the saddlebag back because we've removed the total number of fat cells in that area.
Oh, okay.
Okay?
Well, that's a very important thing because, you know, fat cells, you know, they live forever unless they're removed forever. So we're going to go back to the phones. We're going to take your call, Linda.
Hi, good evening. I think that Monica may have answered, well, you may have answered my question through Monica. I really wanted to do two things. Number one, I wanted to verify if I am a good candidate.
Okay.
I'm 33 years old. I'm 5'4", 135 pounds. I'm extremely muscular. I've been very, very thin all my life until I quit smoking last year. And all of a sudden, you know, the genetic issue just came into play. My grandmother and my mother both very heavy arms and very heavy abdomens. No matter how thin they were everywhere else, these are just problem areas.
Oh, and so your concern is that here you are, 33. You basically, you know, your height to weight is not that bad. Your base body index.
Right.
Is it your arms and your abdomen that you're concerned about?
Right. It's just like I just consider it like a misshape. Like I looked really, really, really good when I was very thin, and now that I've gained weight and I feel kind of, you know, like average, I just have, you know, I feel very top heavy, and then I have this middle portion that's just really, you know, it's really pretty bad.
Okay, and let me just ask one more question before I ask Dr. Zubowski. Sure. Has your dress size changed?
Yes, I have gone up one size.
Okay, all right. We have a dress size. We have some problem areas. Where do you go with this?
Well, I mean, it sounds like, you know, she's a perfect candidate for liposuction. You know, you're not terribly overweight, and it sounds like you have some localized issues. And, you know, assuming the skin quality is good again, you sound like you're a great candidate for liposuction.
That's great. The other only question I had was, I was thinking, you know, because I'm married, but we haven't had children yet. If I did want to do that, would the weight, you know, would I possibly have to do this all over again? But if the fat cells are removed, I guess that would not be an issue.
That's right.
Okay, great.
You passed the test, Linda. You heard it, you remembered it, and that's the truth. When they're gone, they're gone. And Jackie, you're on the air.
I had a mini tummy tuck and liposuction about 2 years ago. And I guess my genes are kicking in because I'm getting heavy on my abdomen again. And I hear that you're saying the fat cells are removed, they shouldn't grow again. But I guess genetics take over and they're growing because my abdomen is growing. And even in my back area, I see I have love handles where I didn't have them before. So do you recommend that I do the procedure again?
Well, let me answer some of that because fat cells that go are gone. However, the fat cells that are still there, they can just sort of get hefty little fat cells. However, you know, Dr. Zubowski, this question is going to keep coming back. For this particular individual, what do you say to her?
Yeah. Well, yeah, it's an interesting question in that, and let's just back up a second, because there are patients who require combination procedures, okay, who require liposuction in some areas, for example, in the love handle or flank area, and then a tummy tuck to address issues in the tummy. And it's not always safe to do those procedures together. And you know, so that if, for example, a conservative liposuction was done at the time you had your tummy tuck, then you might need to have some more fat removed if you're noticing a localized area of fat deposition. So it's not unusual to see several years down the road further liposuction in areas that maybe you weren't treated for in the past, or as your body habitus changes and the configuration and location of your fat changes by weight gain and so on, you may require some of these touch-ups, so to speak.
Well, we're going to talk about touch-ups and more. We'll take more of your comments and questions on liposuction when we come back after these messages, so please stay with us.